Good morning. Um, Good morning, Dr. Akram Khuluqi and Dr. Musab Musaddi. It's very nice to talk with you about this important health issue, which is the relation between fasting and heart health, and also how we control our weight in general, and also during the fasting month of Ramadan. So, if you want to introduce yourself to your audience, Dr. Akram, and then Dr. Musab.
Okay. Good morning. Akram Kholoki or Akram Kholoki, interventional cardiologist, practicing in Northwest Indiana for the past 25 years, um, both general cardiology and interventional cardiology.
And my name is Musab Musadi. I'm a pulmonary critical care and sleep medicine specialist with special interest in dealing with obesity. I practice in the southwest suburb at Little Company of Mary right now, and working with Dr. Sahlul just recently joined the forces.
Okay, well, thank you very much for being with us. So in this program, we do it on a weekly basis. We call it Oxygen Weekly, and so we address sometimes global health issues, sometimes issues related to health in general. And we had a couple of programs addressing the issue of fasting and its impact on health from different perspectives. So today we're going to focus on fasting, obesity, controlling weight, and also the impact of fasting on the heart function. Heart is very important organ in our system, and also patients with heart disease, of course, sometimes they have issues about is fasting good for their heart disease, whether it's congestive heart failure or coronary artery disease or even hypertension. What we need to do during this month to make sure that our conditions will not impact it negatively during fasting. So that way, because the purpose of the fasting is to gain health in general and not to hurt yourself. So let's start with this general question, Dr. Koloki. Is fasting good to the heart?
Actually, in a nutshell, it is good for the heart. And with taking some consideration, overall, it is good for any person considering their medical condition. But heart disease is basically, if you want to categorize it, you have to consider like hypertension as the major component of patient that we see with heart disease, congestive heart failure, and then coronary artery disease, as you mentioned. So for patient with hypertension, I mean, of course, if you have a regime where you have certain time of the day where you fast, considering taking your medications appropriately and not to binge when you break your fast, and watch exactly what diet you're on. Having 12 to 14 hours per day where you don't have any food or fluid intake should not have a negative impact considering your conditions. So we can talk about that more in details, but that was just like a yes or no answer.
So how do we maintain a healthy heart in general and also during the fasting month of Ramadan?
Okay. So in general, if you talk about preventive measures, like for someone who has no issue with heart disease, we always focus on preventive measures that you need to take. So basically, exercising regularly, watching your diet regularly, and weight. So basically, those are one of the things that you can do to modify your risk factor for disease. So if you have family history of coronary artery disease with high cholesterol, of course, watching diet and checking your cholesterol regularly to try to modify that risk factor is a major impact. Hypertension, if you have history of hypertension, controlling it with diet and weight control is probably sometimes can prevent from having to go on medications. Smoking is a major thing. So, I mean, unfortunately we don't choose our parents. So genetics sometimes you cannot change. So if you have a family history, you have to live with it. But you can modify other things. So if you have smoking history, definitely you got to work on that. You can change your diet, you can change your routine, your exercise, a stress level in your life. So you can modify what we call modifiable risk factors in your life, and that is mainly applies to every other disease. But in cardiac diseases, it makes a huge difference because you can prevent it. And see, heart disease is a killer more than anything else. Cancer is a killer, but unfortunately, cancer we don't have that much preventive measure that we know about that we can do to avoid having cancer. But when it comes to the heart, we do have things that we can do to modify our risk and minimize the risk of such a killer disease that we have.
And of course, you can also stop smoking. Smoking is one of the important carcinogens. Reduce maybe intake of meat, which especially grilled meat and so forth, that maybe and increase the intake of fibers that reduce the risk of colon cancers, and we can talk about other screening issues. But in terms of the heart, Dr. Koloki, you're right. But in Ramadan in particular, is there any things that we need to make sure that, especially patients with heart disease, that they need to do to maintain healthy heart?
That's a very good question, because sometimes when you have heart disease, you are taking medications, and when you're cardiac medications, you're very dependent on these medications, and some of it are twice a day. So I get a lot of questions from my patients: can I fast, or should I fast if I'm taking my medication? And they should be spaced out 12 hours apart. So here's what you have to discuss with your cardiologist. There's certain medications that you don't have to be exactly 12 hours apart. There's medication that we can modify to be once a day. So I have patients, for example, they were on blood thinner that should be taken twice a day, and it has to be 12 hours apart. And there was a concern if they're taken like within 7 hours apart, that may be too much within 12 hours. So we switched to a once a day drug that can do the same thing. Same thing with hypertension, same thing with CHF. There's a lot of medication that they come in a form that can be once a day. So that would be one thing that I would definitely consider adjusting if I have a cardiac patient on medications. Secondly is definitely watching your weight, because when you're fasting, if you're on diuretics, so patient with CHF, if they are on regular diuretics and they're used to take certain amount of fluid and they are adjusted to that amount of fluid in the diuretics, if they go fasting all of a sudden and they have 16, 17 hours with no fluid in their body, and they're taking a strong dose of diuretics, then of course you may be worried about the renal issues. So you have to work on these areas.
Okay, so speaking of weight control and the fasting, sometimes many people believe that if you're fasting for 30 days, Dr. Masadi, that you should lose weight. Right? You're cutting your calorie intake for, as Dr. Koloki mentioned, for between 12 to 16 hours, even sometimes during the summer time when you're fasting in the summer. But that is really not translated in practice most of the time. So most people do not actually lose weight during fasting. And there were some studies were done that showed that. But let's talk about fasting in general. Is fasting equal to starvation?
No, actually, starvation is involuntary absence of food. Like, it's out of people control. So you don't know when is the next meal. Like in the old cavemen, they had a prey and they don't know when the next one will be. Fasting is you're choosing the abstinence from food, like for a time period. Like you're kind of specific, very specific. Exactly the start and the end. So it's an intentional process. And obviously, it's from the ancient history. Ancient Greeks use it as a remedy because it helped healing. They found like animals when they're sick, they don't eat, so they felt this is a way of healing. But it's not equal to starvation. As a matter of fact, you get more energy. There's a big study in Minnesota was done about starvation, and people lower their metabolism, but by fasting, there's actually increase in metabolism, almost up by 14%. And sometime in 3 weeks, if they do it right, people could lose 3 to 6% of their body weight. There's a growth hormone increase after when you fast, and it leads to fat burning and muscle gain. When we continuously eat, we actually never give up our body, because always when you eat, there's a spike in insulin. And by having high insulin levels consistently for long term, it leads to higher insulin resistance, which is the main cause for obesity. And when you abstain from eating for some time, the insulin levels goes down, and that leads to start building that insulin sensitivity and maybe lowering the body weight set rate, because the body has a set weight in the brain that keeps trying to bring it back down every time you try to lose weight. So there's multiple benefits for fasting, apart from what Dr. Koloki mentioned. like that more higher metabolism, growth hormone increase, lowering insulin levels, even cellular repair and removing waste material, because fasting was found to promote autophagy, which is like the body eats itself, but it's basically cleansing. Even some studies of 8 weeks of intermittent fasting was able, there was a benefit of decreasing depression and binge eating behavior. The problem with the practiced spiritual fasting that we witness and most likely don't lead to weight loss, it's because we do kind of binge eating. Like, just because we're decided not to eat for the 12 to 16 hours, we decide like I have to compensate and overcompensate, and we just indulge in eating repeatedly in those short hours. And sometimes you eat more during the month of fasting than when you did before the month of fasting. So that's actually negate most of the benefits. So that's where most people don't lose weight. And also gorging, particularly high refined carbs, takes away most of the benefit of fasting, because it really increased the insulin to the highest degree. The other part is going to sleep after eating immediately, and snacking throughout the night. Like, if you just actually take the food that you eat right now and you just split it to fasting period, 16 hours and 8 hours, and the same amount of food, you just split it evenly, you actually would have some benefit of weight loss. It's just if you overdo it and snack all the time, then you kind of negate that effect. So
that's interesting. So nowadays, of course, we have an epidemic of obesity in the United States and many other countries, and 2/3 of Americans, our fellow Americans, have overweight issues, sometimes extreme obesity. And one of the trends right now is this diet with intermittent fasting. So is this similar to the fasting in the month of Ramadan when we talk about intermittent fasting in terms of the benefits and the impacts of the hormones in the body and insulin sensitivity?
Yes. So the intermittent fasting just doesn't include not drinking liquids. And you actually can there's a little bit of tricks that you could utilize while you're fasting. But it's actually has been studied, and it's like gaining popularity recently because a lot of celebrities are using this. And it's actually a very effective way into lowering the insulin levels and lowering the basically insulin resistance, which is the main culprit of obesity. So all those benefits that we mentioned, like whether burning fat, especially after 5 hours of fasting, it could start, increased metabolism, growth hormone surge, cellular repair, or even process of genes and molecules repair that's linked to longer life and better memory. They're all actually can be it was studied and proved in doing intermittent fasting. Now, a lot of people equal fasting to starvation, and that's what's not true. And actually, in my experience with people that I work with for weight loss, that if you just ease into it, it becomes like such a natural thing. And if you ask people who practice fasting in the month of Ramadan, they tell you after 2-3 days, we don't really feel hungry like all day till you start smelling the food that's cooked at the end of the day. But it's mostly not true that you feel deprived. It doesn't take away the energy, and there's so much more benefits, and all those that I just mentioned earlier. The benefit of fasting can be actually seen with intermittent fasting. So you're allowed to take some water, coffee without sugar, tea, maybe a little bit of touch of cream, green tea, even bone broth. If it's homemade, it's really filled with salt, and all those, they're still valid, and you still be counted as done intermittent fasting.
So Dr. Koloki, by the way, Dr. Al-Msaddi also have an expert in behavioral modification. Is that the right term?
Kind of, yes.
And
Because
so,
really, obesity is mostly a mind game. Like a lot of people, like if
controlling weight.
yes, and lowering the weight, a lot of times it's if knowledge is what all we need, diet and exercise, everybody has access to everything on the internet. Everybody should be thin and have six packs. The problem is applicability of the knowledge. It's different because we have a lot of roadblocks in our brain that stands in the way. So there is a lot of behavior modification, and basically it's just learning how to overcome the things that takes you away from achieving the goals. Basically, how to stay consistent, how to focus on the right thing, how to move your intention to lose weight from something painful to something actually enjoyable, and how to make that process just enjoyable instead of like a chore, instead of I have to feel deprived if I am to lose weight because I'm going to miss 1, 2, 3. And and life is celebration. There's a lot of celebration time. It's just not to indulge and binge, but it comes from learning to control the mind and learning that to build the right habits and stay on the right track. And then it's okay if I did something, I don't beat myself up. I just do something else to compensate for it instead of just say that I can't do it.
So Dr. Koloki, when you fast, when I fast, and part of the fasting is this reset of our brain, and maybe changing some of the habits that we had accumulated throughout the year, installing some discipline, and maybe changing our behavior. So there's an element of behavior modifications. How is your fasting is different than the rest of the year? So there are certain things that we all do during the month of Ramadan, and it's different from person to person. That is different during the month of fasting than the rest of the year. So from your perspective, not as a cardiologist, as a person who fasts, what do you do differently in the month of Ramadan that you think that this is really changes your behavior or changes your habits?
Compared to fasting and outside Ramadan, you mean?
Compared to just the rest of the year without fasting.
Okay, so outside fasting. Yeah. So, okay, behavioral changes that you do during the month of Ramadan compared to the rest of the year. Well, it's a very good question because basically, like I said, not as a cardiologist, when you are aware of what you're doing and you are in complete observation of yourself and trying to not to eat and not to drink with every second in your mind that you are allowed to do it and it's halal, but you are preventing yourself of doing it, then that comes with it. Overall, you're aware of every act that you do, not just simply the eating and drinking. So everything that you do, you will have to put it on a scale and start thinking, is that the right thing to do or not? Because you are in full observance of yourself at that time. So I think it's training you to be connected all the time to your Lord, if you are really a believer, where you have somebody who's supervising and overlooking and counting everything you do. And the same thing that I would not be behind closed doors in the bathroom, I would not take a sip of water, even though no one is around me, then the same feelings should be applied to every act that I do, that someone is with me. And then that will change your behavior completely. I mean, believe it or not, I mean, I have not forwarded anything on any social media, not just in Ramadan, but in the past. Many times you click to forward and they say, okay, let me see. Is it going to be beneficial? Is it adding anything? I'm not saying about bad text or anything, but anything that you are not doing with a good purpose, you will have to think twice before doing it when you have some kind of like this level of awareness. So I think that's the main thing. If I would say that fasting teaches you is to train yourself and know exactly that every act that you're doing is being counted on and someone is going to really hold you accountable. So that will make you a better person because, I mean, definitely if you're a believer, you know that everything you do, even if it's the size of the atom, whether it's good or bad, you'll be rewarded or you'll be punished for. And I think that is one of the main aspects that I see in Ramadan that's outside Ramadan. Even forget about the fasting experience itself.
So self-awareness, you want to call it, being conscious of your acts, your thinking, being aware of things around you more than it have. What do you
not
call
just
that?
Self-awareness. but not self-awareness, because I mean, Zahir, self-awareness is something that you are doing for your own benefit, that you are okay. I'm not eating unhealthy because I know it's healthy for me. That is self-awareness. But this is more of observing your creator, that he is with you. So I think it's more, I want to make it a ritual, more of a religious meaning than just like simply self-awareness. Self-awareness could be just with anything, that you're healthy, eating, you're exercising, you're aware of your environment, and just to be for the own good of yourself. But this is more of being connected with your creator and try to do what you were created for.
Okay. So, Dr. Msaddi, you want to expand on this concept?
The intermittent.
No. I mean, fasting. How is it
Yes.
different than the rest of the year, besides abstaining from food and the health benefits?
So
Yeah.
most of, like, there's this, we're talking about spiritual fasting, and there's a lot of cleansing and purification. So not only it happens on the body level, but it's supposed to be, and that's even like Buddhism, they practice fasting, and it's a form of cleansing, like by having the intentional, I'm abstaining from food and drink, you're having that intentional purification or of the body, and basically in the Muslim faith is that the fasting was written for you so you can attain that pious state, being more pious. And there is that form of, it's not just abstinence from food and drink, but it's actually being good to others. Don't backbite people. Like it's more being at your best form and shape, and not just because you're becoming the person, you're practicing this, and nobody can see that you're actually truly fasting except the one who knows you, right? And just being mindful of being good to. It's feeling for the poor. When you're abstaining from food, it's actually to know that, okay, how the poor person feels. And that's why we shouldn't be binge eating in the end, but rather feeling for, okay, I can help other people who are not as fortunate as me that having access to food. I can be of an impact. I can make the difference in other people's life, instead of like, I want to overcompensate and just eat all the time when I'm breaking fasting. And it's just bringing that feeling of that we're all one, we're all humanity, we're all human beings, we're all deserve same things, and just live in that moment of being connected to one another and feeling for another, and living a life and that's more meaningful.
Yeah,
so
and
that answer the question.
definitely. And I think also there's an element of self-discipline, being aware more of time. So you abstain from food and drink exactly at certain time, and you start eating and drinking exactly at certain time. So being aware of time and how to control your interaction with the day, with time. I think this is kind of instilled within 4 weeks of fasting certain discipline. Abstaining from certain habits that are not healthy, whether it's smoking or binge eating or snacking throughout the day. That's also something that you don't do in the month of Ramadan. So it may take a couple of weeks to establish a habit. It takes longer time to remove that habits. And this 4 weeks will help you kind of self-disciplining, so you can remove these habits of that will hurt your body. One time also, and especially now we're reflecting on climate change. I think it's important to connect fasting to our footprint, carbon footprint. And so each one of us produces carbon, which increases global warming, and because you have carbon in the atmosphere. One time I did calculation myself, and I produce more carbon than 6 times more than the average person who lives in other areas in the world. We Americans produce a lot of carbons because we have big houses, we have big cars, we have multiple cars, we use electricity all the time, and we use light most of the time, and that produces more carbon. So we are contributing to climate change, to global warming, more than other people on the planet. So why not link also fasting to reducing our carbon footprint, so that way we can establish certain habits. We look at our house, how can we change our light to LED lights? We look at our cars, can we, maybe the next car can be electric car or hybrid car, so we can consume less carbons. Eat less beef, because as we know, cows can produce methane gas that will also increase global warming. So all of these benefits can reduce your carbon footprint in the month of Ramadan. And imagine if 1.5 billion people, Muslims, during the month of Ramadan, reduce their carbon footprint. That will be translated in much better weather and reduce the impact of global warming. What do you think of that, Dr. Khallofi? You're smiling.
You need to add an ad down in the bottom for the electrical car that you are trying to mention. But absolutely, I think that is very, very outside the box kind of way of looking at things, because exactly what you're saying, the same way that I'm trying to train myself to kind of limit the usage of resources, then I can probably apply it to everything else in my house. I mean, or anywhere else at work, that you can find a way to minimize the energy wasting. That is absolutely, I mean, we waste tons of things in the United States. You said not just simply using, we waste. I mean, the term using, it's a really more benign term than what it is. We are wasted. We waste a lot of things, whether energy, whether food, unfortunately, and that's a main lesson to learn from Ramadan and fasting, that you should be able to limit yourself to only what you need to get through this. One thing that we probably did not mention is, I don't know what's the experience of others, and you probably see it more, smoking. When a person can fast for 16, 14 hours a day without smoking a cigarette, it doesn't click to his mind that if I was able to do it this way, then I should be able to cut down the amount of smoking. Do you come across patients that you're able to convince them to quit smoking just because they were able to fast Ramadan and survive it without smoking all day long? Or do they just simply go binging? Because I have a patient who does this, and he goes, I just smoked the 2 packs from Futur until Suhoor, just like chain smoking, as if you have a duty that you have to finish it, and you have to do your requirement for the day. So what do you think?
So, I mean, tobacco smoking is addiction, and like any other addiction, it's very difficult to get rid of. I mean, I hope that it is as simple as, determining I'm going to quit smoking or quit using drugs or quit using opioid, because you have a lot of addictions, or even porn and things like that, which is very common. So it's a little bit more complicated, but at least if you can make the intention and you do it during the 16 hours of abstaining from food and drink, of course you cannot do these things, then it should make it easier, in theory at least. What do you think, Dr. Msaidi? I mean, this is a very important question, because there's a lot of addictions within the community and beyond that.
So it's actually a powerful tool to utilize to help people abstain from smoking. And you're trying to show them actually they're able to during fasting hours. So, but the way I work on it, it's the same way I work on it with the weight loss. How I help my patient lose weight is to teach them how to take control of the matter, is to and understand the bigger picture, because a lot of times we don't see that it's much more tied up not to the just instant gratification of the cigarettes. It's more bigger picture, that at the same time they're fulfilling the instant gratification every day, they're not looking at the bigger picture, what they're committing themselves to. And I asked them, hey, what's the reason that you want to be around here 10, 20 years from now? And I look for those reasons, and I tell them, you're not basically looking at the big picture, because how committed are you to be around for your kids, or their marriage, or seeing your grandkids? It's the same action that you're doing right now. It's actually taking away those results. And once they see the bigger picture, they're more motivated to do it, and they're more driven by choosing powerfully to, hey, I can quit smoking. It's an addiction. It's a bad habit. It's not easy to overcome, but you have to put much more bigger necessity to and understand the bigger picture, so you can propel people to powerfully choose to quit smoking. Because it's not easy. Like, there's a lot of addiction factors, and there's a lot of dopamine involved, and it's as bad as any other drug addiction. So you need to utilize all the forces that you could have to tackle that issue, so you can work on their mind, so they can powerfully choose and be okay with that choice and be powerful with it.
And you know, one more benefit, now that we're talking about other benefits, and we'll end with this, and maybe we can you can add your comments, is to be aware of disparity. You know, this is something that we witnessed during this COVID pandemic, that we have you know, populations that have lower access or less access to healthcare than others. And you know, it's well known right now that if you're African American or Native American or Latinx, and you are more likely to have COVID or to die from COVID or to have more complications related to COVID. So, and this issue of disparity is a disease that we have to address in our society here. We have to be aware of first. We have to work to reduce it. And one way to reduce it is to make sure that people have equal access to healthcare, equal access to medications, equal access to specialists like yourself, and to vaccinations, and address the root cause of lower access to healthcare. Our goals, by the way, in MedGlobal is to reduce healthcare disparity, which I believe that this should be our universal message. So you want to add anything to end this, Dr. Koloki and Dr. Al-Musaddi?
I'm fine, I think.
Okay.
I agree with
Thank
that.
you very much for having us here. I think we exceeded 30 minutes, but people have control. There is disparity between one another, but you could always take ownership of what you can do, rather than looking at the reason why things may be a little bit harder for me than the other person. So by taking ownership, you're able to make the difference despite whatever, you know.
And raising the awareness, like just what you said, Zahir, if we just say it loudly and clearly and trying to open the eyes of people about this, people sometimes they just ignore it or they don't see it. But when you bring it up more and make more awareness of it, I think that will make change, because people do sometimes subconsciously do these things, and when you discuss it more, it becomes more something that you try to avoid doing, and try to treat people equally.
All right. Well, thank you very much, Dr. Koloki and Dr. Musaddi, and happy Ramadan, happy Eid, everyone. We'll see you around. Thank you.
We'll see you.
Thank you for
Thanks.
having us.